there is no particular cure or treatment for coronavirus. What we are doing is symptomatic management. We have to manage these cases as per and how they present. And more so if they have other comorbidities. For example, if they are diabetic, hypertensive, renal issues, cardiac issues, cancer issues, all these are the ones we maintain. And the more we maintain the patients, more often than not, they tend to recover. And as Waziri has said, people must take things seriously because you don't know. Virus behave differently to different people. So whenever, don't start relenting your effort because you think people are getting well. It is always important for all of us to take our responsibility and let us start behaving. Especially some of the people who go for these areas of quarantine, they are becoming so hostile even to the workers. Even some of my workers have had to be physically abused by some of you who have been out there. Please, these people are out there. They are putting their life at stake. The least you can do as Kenyans is to give them some little basic support and even show some level of etiquette.